Live from Melbourne, this is 7 Afternoon News with Rebecca Madden.
Returning now to Melbourne's Legionnaires outbreak, which has claimed its first victim, a woman in her 90s. The source of the deadly disease remains a mystery, but the Health Department has narrowed its focus to Derrimut and Laverton North. For more on this, let's bring in Professor Elizabeth Hartland, the CEO of the Hudson Institute of Medical Research. Professor, how concerned are you with how quickly cases seem to be climbing, and how significant is this event?
Yeah, this is a really significant Legionnaires outbreak for Australia. It's our second largest outbreak to date. It's unusual for a couple of reasons. The first one is the time of year. So most Legionnaires outbreaks tend to happen in summer and autumn. But the other unusual feature is that there are so many cases in hospitals. So it does look like a very severe outbreak from a health point of view.
I wanted to ask you about those hospitalisations. All but one are in hospital. Do you think more deaths are likely?
I think that's really hard to say. The people who experience most severe disease are people with underlying risk factors such as advanced age, or they may be immunocompromised or have some underlying lung disease such as they're a long-term smoker or chronic obstructive pulmonary disease. So when those risk factors occur alongside a Legionella infection, then those people are at more risk. But early intervention with antibiotics is the best treatment for people, and supportive care in ICU. So I'm sure they're being given every possible care that they can.
What is the process in being able to determine the source of this outbreak?
Yeah, so tracing sources of Legionnaires outbreaks can be very difficult, and the only definitive way to link a source to the outbreak is to have those strains matched. So to get the genetic information from the outbreak strain and match that to environmental samples. And so when that is a very close or exact match, then we can say that was definitively the source of the outbreak.
So the Health Department has flagged Derrimut as a potential source location. That's where we recently saw a factory inferno. What's the possibility of that being behind this?
I think that's really difficult to say until we know exactly which cooling towers have been implicated. There's no direct link in historic outbreaks between that sort of fire and a subsequent Legionella outbreak occurring. So, having said that, something has gone wrong. We have among the strictest regulations for cooling tower management in the world, and a world leading in our controls on Legionella. So something definitely has failed here, and unfortunately, yes, there are so many people who have contracted Legionella and are quite sick.
Yep, let's hope we get on top of it as soon as possible. Professor, really appreciate your time. Thank you.
Yeah, thank you.